Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine, innovation, and leadership. My name is Dr. Padmaja Patel, and I'm the current president of American College of Lifestyle Medicine and serve as the Chief Medical Officer for Nudge Health. Each episode delivers 5 key takeaways from leading experts and practitioners on how lifestyle medicine is reshaping the future of healthcare. Through practical strategies and real-world success stories, we empower you to make a lasting impact in your practice and beyond. In this episode, we are honored to be joined by Dr. Samrina Marshall. Dr. Marshall is board certified in pediatrics and lifestyle medicine with leadership experience in value-based care organizations and health plans. Primarily with Medicaid payers, she has led various initiatives in the development and implementation of integrated, person-centric chronic disease models of care. Lifestyle medicine aligns with her core interest as a catalyst for healthcare transformation and advancing the quintuple aim. Currently, she serves as a healthcare advisor with ACLM, supporting the Innovators Council, a group of risk-bearing organizations in implementing lifestyle medicine. In addition, she chaired a task force of lifestyle medicine clinical leaders to develop the lifestyle medicine high-value care framework, which was recently published in the American Journal of Lifestyle Medicine. Throughout her administrative career, she maintained her clinical role as a volunteer clinical faculty at UC Davis Medical Center in Sacramento. Welcome, Samrina. How are you today?
Thank you so much, Padmaja. It's a pleasure to be here. I'm doing well. Thank you for inviting me.
Oh, what a pleasure to have you. I'm really excited for this conversation. So before we flip any scripts, let's set the stage. Walk us through the moment or the series of moments that pulled you toward lifestyle medicine. Was there a patient, a frustration with conventional care, or a personal revelation that made you think there has to be a better way?
Absolutely. Great question. I'm a pediatrician, and at some point early in my career, I was feeling like I'm not doing the best for my patients. And we go into healthcare because we want to help people. Mm-hmm. And in pediatrics, it's primarily acute conditions. We saw less chronic conditions. And in fact, early on in my career, type 2 diabetes used to be called adult onset diabetes. We just didn't see it as kids at all. And now we have like 1 in 3 adolescents with a diagnosis of diabetes and 1 in 2 in certain high-risk populations. And we know that the earlier onset of this diagnosis can have a far worsening impact and with complications in young people. So, all of these statistics are horrifying as someone who is just feeling my hands were tied. And then we know that 80% of the drivers of health are outside the clinic walls. And so the social, environmental, and behavioral drivers that we can't impact alone. And so with my MPH and a population health lens, I was kind of drawn to working with organizations that were focused on chronic care models. And but it was actually when I attended a lifestyle medicine conference. And that's when everything clicked. It's like, this is the how. This is really a sustainable, workable solution as to how you can actually move the needle. And after that, I was hooked.
Yes, that's always a great story. I think all of us get that sort of high, right? Attending a conference or meeting someone who is deeply passionate about lifestyle medicine. And yeah, I would say conferences are very unique place, especially for ACLM, where you actually get to experience the community, but also what is lifestyle medicine in real world and in practice. So thank you for sharing that. The word high value care, I would say, gets thrown around a lot in healthcare these days. Sometimes it really feels like a buzzword to me because I bet it means different things to different people. So let's define it on our terms. What does high value care actually mean? And why does the current system so often fall short of delivering it?
Yeah, so true. So many buzzwords, and value is a big one. And what is value?
Yeah,
We're not getting the value that we need in our healthcare because we have a healthcare crisis, as you know, where we have rising prevalence of chronic conditions, and yet we are paying more and more every year. Now it's like 5 trillion, per
the
year in
cost.
in the U.S. The cost, the total healthcare costs,
Mm-hmm.
and for that we're getting worsening health conditions. So that's not value. And things have changed in our populations, and the healthcare system hasn't adapted to that change. In the mid 20th century, we had better treatment for infectious diseases, so we shifted away for more acute conditions. People were living longer with more preventive techniques and medication. And lifestyle changes were also happening, though. So while people were living longer, we had more people who were sedentary and were exposed to more processed foods. And so there was a rise in, age-related chronic conditions. And now we're left with 6 out of 10 adults with at least one chronic condition. So our health system just didn't evolve to really support this growth in chronic conditions in this epidemic. And so with the various attempts at reform, value-based care came up as a new payment model to support quality of care versus quantity of care. So instead of going in multiple times for evaluation of your hemoglobin A1C, what can we do to actually improve your hemoglobin A1C
Mm-hmm.
and get reimbursed and supported for the actual improvement rather than the frequency of the visits alone? And this became formalized as a strategy for reform about 20 years ago, but gaps remained because there wasn't alignment with stakeholders. So alignment across the health system and providers and payers and even the patients, it just wasn't aligned. And so the term high value care became more used because it really gave you more of a how, and it
Mm-hmm.
gave you a framework in how to succeed in value-based care. And that really means we need to deliver something called whole person health. And whole person health is, as we know, something that is really patient-centered, person-centered, and evidence-based. And that's providing really comprehensive care for that patient that includes the physical, the behavioral, and the social. So if we take that example of the hemoglobin A1C, we can chase a metric around how to improve that
Sure.
number. But what are we doing to actually focus on what matters most to the patient? What are their goals? Is their goal to improve a number, or is their goal to focus on activities that the hemoglobin A1C or their diabetes is impacting? Family time, or recreational activities, or
Mm-hmm.
mobility, but their quality of life. So giving advice such as eat better and move more is well-meaning and wonderful. However, it's insufficient to really move the needle on making these changes. So with approaches that are whole person and with lifestyle medicine, we look at these 6 pillars because we know with the hemoglobin A1C, it's more than just nutrition and physical activity advice. What about their stress level? Are they sleeping, okay, or they're having, chronic insomnia issues? Are they lonely? There are multiple factors that contribute to the chronic conditions that we know. So when patients themselves become empowered to drive lifestyle change, that is what becomes sustainable. And high value care is just that, a sustainable approach to improving
Mm-hmm.
health outcomes. And it's that alignment with patient, provider, and system.
Right. Yeah, I like that lifestyle medicine might just be the most logical pathway to achieving that. So help us explain us, how does lifestyle medicine deliver value in ways that conventional traditional approaches of medicine and the care that we generally give I would say, even as a sort of an internal medicine doc that I've served, I saw the difference significantly. But I want to hear from you. How does lifestyle medicine deliver that high value care that traditionally clinicians have struggled to deliver?
Exactly. Well, since we know that 80% of chronic conditions are related to, lifestyle factors, we can actually support traditional care by being additive rather than something that's replacing traditional care. So that's the beauty of lifestyle medicine, is that it's complementary rather than replacing. So you can have your cake and eat it too. You can
Sure.
have the surgery, the antibiotics, the medication, everything that's needed. But where we fill the gap is providing that essential power around lifestyle change that's going to actually move the needle on the chronic condition. So, our current system in many ways is sort of like a square peg in a round hole. We're trying to do a certain type of care, but it's not addressing those lifestyle factors. And this is where lifestyle medicine becomes really powerful and just really addressing the needs of meeting people where they are. So complementary, proactive care, that true evidence-based catalyst for healthcare transformation. And when we talk about that, another buzzword is like quintuple aim. But really, when we're talking about healthcare transformation, we need to move the needle on all these aspects of our healthcare goals. So a cost-effective strategy, which lifestyle medicine is, and improving not only the patient satisfaction, which we know it does, but the provider satisfaction, because there's less burnout. And you're doing this in a way that's improving the actual health outcomes and in a way that's advancing health equity. And we can, talk about that more. But so how exactly does this achieve this? When you have a whole person approach, the patient is at the center, as we've seen, those comprehensive assessments, not just their physical health, it's also the behavioral and social. And then we have this interdisciplinary care team, interprofessional care team, made up of physicians, nurses, therapists, coaches, and that really provide that comprehensive care. And that care is provided across a continuum. So it's not just prevention, but it's also, more importantly, treatment and disease remission. And surrounding this care team, there needs to be a system, a health system, and a community that really focuses on integrating lifestyle medicine at all points of care. And this is where I get excited about lifestyle medicine, because people don't think traditionally of lifestyle medicine as being something you can do in an inpatient setting or an emergency department, but it is. And so whether it's in an outpatient setting, it could be primary care or specialty care. In the inpatient or ED, there could be a lifestyle medicine team that's deployed to, close the gaps on some of those social drivers and other behavioral factors that are driving the frequent flyers or frequent readmissions. And care can be provided in the clinic setting, in the hospital setting, or in a community setting, and even in a home setting. And you mentioned the framework, the lifestyle medicine care framework, and the American Journal of Lifestyle Medicine recently published that as the framework for high value care. And this actually can serve as a roadmap for implementing lifestyle medicine, actual implementation. So LM really is that high value care solution, because we're taking this more broader, holistic approach.
Right. And I love that infographic that we have created for a high value care framework for lifestyle medicine. And I want to say this because I just came back from attending the CMS Quality Conference in Baltimore. And I saw one slide where they talked about what is whole person health. And it exactly depicted that center, the whole person care that we have defined. And so I was very pleased to see that how much we've been able to influence the thinking of the industry of what is high value care of lifestyle medicine. So thank you for leading that important work, Samrina. But I want to say there is a criticism that we hear about lifestyle medicine quite often. People would think that it's probably for people who are, what we call is probably worried well or truly not sick or underserved. So tell us, how do we make the case for lifestyle medicine for all people? It's not just for those who are rich, affluent, and go for concierge care. So tell us, how do we make the case for lifestyle medicine for everyone?
I love this question because this is why I'm really passionate about LM, and this is why I was kind of drawn to joining ACLM and really being part of this movement. With my background in public health and with Medicaid, we know that the chronic disease burden is highest in the underserved. So any care solution must be accessible and equitable for all. So that's the foundation of our first step in moving forward with any kind of care solution. And LM, as this high value care solution, does address and meets the needs of all populations. And it may seem like, well, how can it do that? Well, it does it because it's meeting people where they are. And that can be literally or figuratively. So literally, it can be virtual, or it can be in person, it can be in a clinic setting, or it can be in a group setting. It can be one-on-one, or as I said, in a group setting, in a community center. So it can be in various multiple modalities. And figuratively, because you're meeting people where they are in terms of their goal setting. People get the advice, and they know they need to eat a little bit better and move more, but what does that actually mean to them? And how can they start making small changes that will be impactful? So this is a critical way that you can advance, health equity, again, because you're empowering that lifestyle change and that concept of shared decision making between the healthcare team and the patient. And it's really quite moving. And we've seen this all the time when people finally can realize, a light bulb moment goes off that, wow, I can actually reverse my chronic condition. I don't have to be on medication my whole life. There's something that I can actually do about it. And then when they have a means to do so, they have the how, they have a resource at their community center to be able to drive that change. That is truly advancing health equity. And so that's really one of the main reasons why I'm here with LM, is because I really feel this is the healthcare solution. And it's truly powerful when you realize the scope of LM, because that is the value, and integrating it into all points of care is something that I think is new and novel for people to kind of get their head around. But as I said, when we can see it in these various settings, how exciting is it that before joint replacement, you can have some prehabilitation, and so much data shows better outcomes after the surgery, so that there'll be less complications. That's pretty powerful.
Yeah. And I think those who question, the need for lifestyle medicine for all people, often don't realize that, we have a way to deliver culturally appropriate interventions and solutions and resources. There is no one size fits all approach to lifestyle medicine, and I think that's the beauty of all our care models. So here is the uncomfortable truth. Lifestyle medicine has been around long enough that if scaling were easy, we would be there, right? So what's actually standing in the way, and what are the strategies, whether in payment reform, workforce development, or systems design, that you believe can finally move this from the margins to the mainstream?
Right. Well, I think it's all of us working together. And what's truly transformational is when we're all rowing in the same direction, and when we have alignment. And as you talked about, the alignment with CMS, that's pretty powerful, because now CMS sets the standards for a lot of, healthcare decisions and payment, of course, and that trickles down to payers. And so when there's alignment with the key stakeholders, it's easier to be able to incentivize and integrate whole person health and lifestyle medicine. So, three core ways I believe, and this is something that ACLM is very strong in leading, is organizational leadership, workforce development, and clinical transformation. So organizational leadership means, really getting that, not just support, but that buy-in, that investment to really implement lifestyle medicine in their organization. And particularly important, and you mentioned the work that ACLM is doing with the Innovators Council, is particularly important with risk-bearing entities and the self-funded insurers, such as the large employers. Lifestyle medicine can deliver goals that matter to these organizations around cost and quality. And there are new and novel ways that LM can be integrated, not just on the clinical side, but within organizations that have strong, activities, initiatives around care management, quality improvement. So you can integrate care management, quality improvement, pharmacy, their community health outreach, member outreach work, to really target populations such as those that are high risk, high need, high cost, oncology populations, the cardiometabolic conditions that we talked about, and can move and can improve health outcomes and their metrics around HEDIS and STARS. And alongside that, we need to have the workforce development, of course, that's going to be able to deliver this care. So training the interprofessional team and, of course, the physicians, nurses, and the therapists and the coaches. But in the payer organizations, for instance, the whole cohort of care managers and the quality improvement team, the pharmacists, these are all people that can be trained with lifestyle medicine so that everybody is, again, rowing in the same direction and aligning the care initiatives that will provide that kind of whole person focus. And the clinical transformation itself, ACLM is a powerful leader because they have an abundance of LM practice tools and educational resources, as well as numerous patient-facing materials. So if you don't know how to do a shared medical appointment, ACLM has the toolkits and resources to do that. Questions about the reimbursement pathway, ACLM has information to support that as well, and actual patient toolkits from 0 to 5 age to elder care. It's all there. It's quite amazing. So I think when we tap into these resources, when we're able to row all together from leadership down, I think we can lift all boats and we can get back into the business of doing what matters most, and what brought us here in the first place is helping people.
Wonderful. Well, thank you. We're almost out of time, but I really want to thank you for taking the time to join me for this conversation, and especially generously sharing your wisdom, your experience, and your insights. And thank you to our audience for tuning into this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.